Hi, welcome to Everyday Parenting Solutions Facebook Live conversation. This is our second one. We're so glad you can join us. And Everyday Parenting Solutions is committed to helping parents and teachers navigate today's challenges, like the coronavirus, raising our children with a compassionate and common sense approach. My name is Meg Zemer, and I'm proud to be affiliated with Everyday Parenting Solutions. I am a preschool teacher, an early childhood educator and specialist, and I would like to take this opportunity to introduce our guest, a friend and colleague, Dr. Bergen Nelson. Bergen is a pediatrician, and she works at Children's Hospital affiliated with VCU. She's a primary care pediatrician, and we are fortunate to have her expertise and have her affiliated with Everyday Parenting Solutions. So Bergen, I will turn it over to you. Welcome.
Thank you so much, Meg. Hi, everybody. I hope you are safe and well. My name is Bergen Nelson. I'm a primary care pediatrician at the Children's Hospital of Richmond at VCU. I'm also a mom to 2 school-age boys, and we are home today without school in session. So I am feeling your challenges on multiple fronts, and I'm just so glad, so grateful to Everyday Parenting Solutions for offering this format for you to jump on and ask any questions that you might be feeling. So I know that this is a very difficult time for all of us. It's challenging. There are a lot of unknowns. So just that disclaimer up front is that things are changing with this novel coronavirus day by day, hour by hour. So given that, I would like to summarize what we know now and try to answer your questions, but also know that there's a lot we don't know. And things are rapidly evolving. So stay tuned for updated information. But just to summarize, coronaviruses are a family of viruses that range from the common cold to more severe respiratory infections like SARS and MERS, and now this novel coronavirus that we're calling COVID-19 because it started in December 2019 in Wuhan, China. We do know that it is very severe for older people. And it has caused, because it is new to the human species, it is going through our world as a pandemic, and that is really scary for all of us. But what I want to say as a pediatrician and a mom is that what we know about this virus so far is that it is relatively mild in children, especially young children. There have been 0 infant deaths across the world with more than 200,000 cases. And more than 8,000 deaths in older people. Younger children have relatively been spared in this epidemic. And so that's good news as a mom and as a pediatrician. I can take some comfort in that. However, we know that the illness can be very severe in older people or in people with other pre-existing conditions like diabetes, heart disease, lung conditions, things like that. And so it's important for us to try to slow the transmission of the pandemic. I think you've probably all seen a lot of the flattening the curve kind of images, and that is really important for us as a society, as a country, as a world, for us to not let the pandemic spike because that will overwhelm our healthcare system. So as a healthcare provider on the front lines, we do not want to see lots and lots and lots of sick people coming in all at once. We want to kind of slow the transmission. So that's why things are happening that we're doing in terms of closing schools, things like the social distancing recommendations that we're facing. And so I am right there with you with that. My kids are home from school now for the next month, really for the foreseeable future. And I know that that's a challenge. But again, even though the illnesses seem to be very mild in children, it's really important that we are staying at home and distancing ourselves from other people in order to slow the spread. Because we know from many kinds of viruses that children can transmit and are rapid transmitters of viruses because they run around, they share things, they put hands in mouths, those kinds of things. We also know that this virus does tend to shed in stool. So for babies in diapers or parents working on potty training, it's really important that you wash your hands and clean well, and maybe consider not having older people like grandparents or people with health conditions or immunocompromised people changing children's diapers at this time. So whatever you can do to kind of minimize that exposure. And then the other thing is we know that there will be some strain on our healthcare system. And so we're encouraging people with mild illness to stay home And what we're doing in primary care pediatrics is moving a lot of visits to virtual visits and phone calls and things that we can answer online and through platforms like this, rather than having people coming into the clinic to be seen. If you are not having shortness of breath, if you feel like you can just have like a cold or a flu and you can take care of those things at home, the safest thing is for you to stay home. So again, that is for the benefit of all of us as a society. It's really like our social covenant, our contract with society, our social responsibility to sort of keep everybody safe. But I, as a pediatrician and a mom, really want to keep you all safe and well. I want you to rest assured that your children are safe, but we need to keep everybody safe in society. So I am so excited to be here with Meg, because as a mom and trying to do homeschooling with my kids, I'm out of breath because I was just corralling them. They were just running around the house, and my dear husband is trying to homeschool them for the last few days. And it's a challenge already trying to think about the next month of this. I have so much respect for educators now, having gone through these few days. And I would love to hear from Meg about some of the ways that we might be able to manage time with kids at home, and while we're practicing social distancing, how they might be able to stay connected to their friends and family while still staying safe. And if you have any tips or tricks for us, Meg, I know at first I thought, oh, this will be fun. We can like go to movies, go to restaurants, have play dates, but really the recommendation is no play dates. Please don't go out. Stay home as much as possible. It's good to go outside and get some fresh air with the people in your household. Go for a walk, but stay away from people and from other households. So how can we manage this, Meg?
Hey, Meg. I muted your line. You're going to have to unmute. Thank you.
Is that good? Okay. Thanks, Bergen. I am excited to share some suggestions for activities at home with your children. I hope I can reassure you parents that no one expects you to be a professional teacher, a professional homeschool parent. There are no rules to this. This is new for all of us. So keep breathing, take some deep breaths. I think it's really important as parents. I have 2 older daughters. It's just as challenging with young adults. I think sometimes more challenging than with little children. I think if we can model calm, we've talked about that. If we can, even if we don't feel calm, model it. If we can keep breathing, practicing self-care. Are we going outside and exercising? Are we practicing yoga? Are we practicing mindfulness? Are we meditating? If you're not, now's the time to do so. It's beautiful weather outside. Make sure your kids are playing outside, obviously not with neighborhood children, but with your immediate children in your family. But make sure you're taking some time just for you, because this is hard and you're on 24/7 and you need to take care of you. One of my favorite quotations is, we can't give to others what we withhold from ourselves. So if your cup is empty, how are you going to give to your little ones? Another thing is, don't stress about screen time. We want children to be happy and healthy. They probably will be watching more TV than usual, and that's okay. But just monitor what they're watching and how, what they're watching is at quality. We have a lot of ideas we're going to post on our website of really great educational resources, movies, books read aloud, interactive things. I think those are great resources to be using. We know, again, screen time. Your child or children are probably going to be using the computer more than usual. That's okay, but they don't need to be hearing about the coronavirus over and over and over. I think we need to minimize that for them. Anyways, know that we're all in this together. We're going to get through this. Things are changing rapidly, and we are going to keep you posted. Now, for what you've been waiting for, some suggestions for activities. I have a long list. First and foremost, children spell love, T-I-M-E, time. So as stressed as we're all feeling, we're worried, we're anxious, if we can take a deep breath, put our phones down, shut the computers down, turn the television off, and just give our children, no matter how old they are, our undivided attention. That's what they're craving. I know we're trying to work from home. I'm trying to work from home as well. It's really challenging, and it's hard, but we can do this, and we're going to get through it together. But the more we give our children our focused, direct attention, the calmer they're going to feel. If you take an hour and sit on the floor and have what we call floor time, doing a puzzle, reading a book, playing a game, talking, just being there 100% present, that 1 hour is going to take your child very, very far. After we've played together, then mom and dad need to do some work on their computer, or after I do some work, then we will be able to go for a walk or
Meg,
play
we have a
outside.
couple of questions for Bergen, if I can jump in. I know you guys cannot
Sure.
see them, so I'm going to read. The first is, we live with my father who is 68. My friend is scaring me and telling me that my kids should be sequestered from my father, which is impossible. Should we be concerned or taking extra measures other than social distancing and sanitation practices?
So that's a great question. And I think that one of the benefits of having this social distancing in general is that we have less likelihood of everyone to get infected, including the children who are relatively mildly affected. They do have the capacity to pass it on to other people. So that's why it's important to keep your child at home and away from other children and out of school and out of public places, probably even out of playgrounds, because we know that this virus can linger on surfaces like metal and wood and plastic for a couple of days. And so I think it is impossible to completely sequester each other from people in our own households. And I think we have to understand that if we contain our households to our households, then we're minimizing the risk to everybody, especially to older people living in your household. But yes, the most important thing we all can do to prevent infection is to wash hands very thoroughly as much as you can. So it's a great lesson for children in general. It's fun to sing little songs while you wash hands. Have a 20-second song, sing, wash, wash, wash your hands, wash them till they're clean. Wash the front and then the back and then the in-between. Sing that twice. Sing happy birthday twice. Whatever it is you want to do, make up your own little song. But washing hands, disinfecting surfaces, letting anyone who is sick and having symptoms actually try to be in a separate room and use a different bathroom. But you're right, we cannot completely sequester each other from our family. And so we're going to try to stay away from other families in order to prevent infection.
Another question from our Facebook Live comment section, and please put your comments there or any questions you might have we can pass along to Dr. Nelson and Meg. The next one says, my son has autism, diabetes, and epilepsy, and then says, how bad? So I'm assuming the question is those extra concerns that she might need to take considering her son's diagnosis.
Yeah, so I think even among children with these chronic and complex pre-existing conditions, the good news is that we have not seen widespread deaths. We have had relatively few pediatric intensive care unit admissions as a percentage of all of the cases. Even hospitalizations for children have been a really, really small percentage. So I think, we can't change what we have. We can't change the fact that your child has these conditions, but we can reduce the risk of transmission and infection as much as possible. Do what you can. But I think, again, rest assured that this particular virus, for some reason that we don't completely understand, seems to have relatively mild symptoms and mild illness in children in general. It's coming out of Italy. There were only 10 children admitted to the pediatric intensive care unit in the entire country of Italy out of 35,000 cases total. So again, that's a very, very, very small rate of severe illness. And so, I think of all of the conditions you mentioned, probably diabetes is the most, affects your immune system and your systemic wellness the most in terms of infection risk. And if you can keep the diabetes under good control in general and just keep him healthy and well in general, like you always do, then you're in pretty good shape. So I hope that helps a little bit. And I know that we can't completely quell everyone's anxiety. We're all feeling some anxiety because of the unknown. but I hope that you can do those things that Meg mentioned, relax, take some deep breaths, try to be mindful, and enjoy time that you have together. I mean, I'm trying to do that with my children too.
So we have a question that's coming from the inside, and we're thinking of you, Susan. It says, I have the flu, but doctor says it's not CV-19. Do I have to stay away from children?
So actually, influenza for young children, I think, is even more dangerous than this novel coronavirus. So if you were a young child, honestly, influenza or a virus like RSV, the viruses that we have going around already that we had before this novel coronavirus, influenza, RSV, were always very dangerous for children. That's why we're so adamant about people getting flu shots and, protecting themselves during flu season. So yes, I'm sorry, if you have the flu, you should also stay home. I hope you feel better and take care of yourself. I know it's miserable. And you will get better, Susan, but you should stay away from children. Yes, please.
So I think a question that's being funneled through some of our monitors here for Everyday Parenting Solutions has been posted. It says, can my kids bike with their friends down the street as long as we tell them not to touch each other?
Great question.
So I think biking is one of the few things that probably is relatively okay because you're on a separate piece of equipment and you can't actually be that close to each other safely and bike. So I think as long as, before and after the biking, you're not hugging and kissing and touching hands and hanging out in each other's houses, that staying, 6 feet apart on a bike out in the fresh air is probably a relatively safe thing to be doing.
Great. Well, we would love to have your questions. We're monitoring it here. We're going to be on for maybe another 10 minutes max. Meg, is there anything else that you would like to share while we wait for another question?
There are a few things. It's really important that we keep our children socially connected. They're feeling angst, they're feeling stress. So technology is our friend. It's a great opportunity to let them FaceTime, let them Zoom, let them Skype. Obviously, you're going to be supervising this. They can send a virtual card to a friend. They can actually, use snail mail, make a card, put it in the, mail for a friend. I saw something where we're making pink hearts for healthcare givers. And so that would be great. Draw a heart, color it pink, or cut it out of pink paper, post it on your door to show your support. There are a lot of virtual museums, galleries, field trips that are available to children, and we will post those on our website. Art projects are great, singing, doing things to help others, maybe donating food to the food bank, baking, looking at old pictures, organizing, making up your own family song when you wash your hands, creating a new greeting using, your hands obviously not touching, having family movie days, movie nights, game nights, organize, go through things that you're going to give to Goodwill, things you're going to share, read. I think this is a great opportunity to teach life skills. If your child doesn't know how to iron or do laundry or put things away correctly, now's the time to do that. This is really a gift of time. In our world, we're always running, racing. We would never wish this upon anyone. But I think it's really important we frame it positively and look at it as quality time that we've been gifted with to spend with our children. Despite the angst, despite the worry, despite that we're trying to be parents and colleagues and do our job and keep up with our friends and maintain all of our social connections. But please call and check on your friends, use technology. Everyday Parenting Solutions is here to help. We hope to continue a conversation of this type next week, and we really want to get the word out that we are here to help you through this time and in general.
And I just wanted to point out some other resources. Thank you, Meg. That was so great, and I'm trying to practice that in my own household. And in terms of medical information, it's important to stay calm and use trusted sources of information. And so sources like the American Academy of Pediatrics, the CDC website, our hospital's website has a whole page on COVID-19. So the CHOR, Children's Hospital of Richmond website, has some great resources, including some videos and pieces of information from infectious disease specialists who are much more expert on this than I am. Johns Hopkins has a great COVID-19 website that's tracking cases, and the Virginia Department of Health. So I think we're getting a lot of opinions and flurry of information, and that's why our time is so unique. We have so much information flying at us all the time, but try to filter that and curate those reliable sources.
Okay. And I do have one last thought to share if we have time while we're waiting for some more questions. I read this, I think it was posted on Facebook. I'm not sure who came up with it, but I think it's helpful to remember. It says, going outdoors is not canceled. Listening to music is not canceled. Quality time with our families is not canceled. Reading a book is not canceled. Sharing with friends is not canceled. Singing out loud is not canceled, nor is sharing with friends. Laughing has not been canceled. Sharing hope with others has not been canceled. And let's embrace what we have. So I leave you with that thought. If you have any questions or concerns you'd like to share, we welcome them, but we understand what you're going through. We're living it too, and we are here to help you through it and help you make the most of it.
Okay, well, we will continue to respond to comments and questions as they come up here on our Facebook Live, and we'll be announcing next week's time and topic very soon. Okay, thank you guys. Have a good day.
Thanks for joining us.
Bye, everybody. Thank you.
Bye.
Wow.
Well.